Hello and welcome to this edition of the Philips African Dialogues. I'm Samantha Loring. Africa is rising, however, so too is the burden of non-communicable diseases. Cancer, cardiovascular disease, high blood pressure and diabetes, once labelled as illnesses of the Western world, are becoming increasingly common in lower to middle income countries. In fact, nearly 80% of all NCD diseases, that's roughly around 29 million, occur in low middle income countries. So it's not a rich world problem. Now, according to the World Health Organization, by 2030, non-communicable diseases will be the most common cause of death on the African continent. Well, in this edition of Philips African Dialogues, we'll take a closer look at NCDs in Africa, including the strategies needed to help address this looming healthcare pandemic. Joining us in studio to share their insights, we've got Dr. Sarah Barber, the South Africa country representative for the World Health Organization, JJ van Dongen, CEO for Philips Africa, Dr. Bobby Ramasia, the CEO for Benitez Medical Fund, and joining us from our bureau in Lagos, Dr. Olanrewaju Ikpeha, representative for the Department of Community Health and Primary Care in Lagos State. Thank you for joining us, of course, Doctor, from Lagos, but I'll take it to studio first. And Sarah, I think I'll start off with you. Just diagnose the problem for us as it stands right now. I suppose we could start off with South Africa and then we could look more broadly to Africa. But NCDs have really been put on the radar and they were very much flagged at a UN high-level meeting in 2011. But how bad and how quickly is the problem becoming worse and worse?
Well, as you mentioned, the WHO predicts that NCDs will be the major cause of morbidity and mortality in Africa by 2030. So it is a looming problem. And the WHO estimates that about 36 million deaths occur from non-communicable diseases globally. 25% of those deaths, or about 9 million, occur prematurely or before the age of 60 years. And among that group, 90% occurs in low and middle income countries. And so this is a strong indication that essentially we are not ready to tackle the burden of non-communicable diseases and that we need to do more in terms of prevention, treatment and care.
I mean, when we talk about the cost, there's so many elements related to it. I mean, JJ, we've often, on these dialogue series, we've often talked about the opportunities and all the areas of growth in Africa. But when you look at an issue like this could really offset or be a major factor which would, of course, hold the continent back.
Yeah, I think it's not only in Africa that we see this, but also globally. We see lots of discussions at this stage about the United States and the amount of percentage of their healthcare budget on healthcare, of their global their budget. But we see, can Africa itself afford that type of expenditure that's occurring? So the biggest, from our side, we see the development in terms of non-communicable diseases. We see the focus should be more towards the areas of screening and prevention, as opposed to waiting for the disease and then having to treat the disease and palliative care that follows thereafter. So it is quite concerning in terms of that. So there needs to be more focus going forward in that direction. I
mean, these are lifestyle diseases, generally lifestyle diseases. What are you seeing from your medical aid clients, your beneficiaries right now? Is the prevalence of it rising for the members you cover?
Well, basically, Sam, from our data in Bonitas, we found that, in 2007, it accounted to close to about 11% of our members that were on chronic medication, which indicates that the diseases of lifestyle. And that number has actually increased to 2011 on our data to close to about 13.9%. And that shows or demonstrates an increase of close to about 20%. So definitely, even within our scheme or our fund, we do find that there's an increasing number of people that are being afflicted by the lifestyle diseases.
Let's get the perspective from Nigeria right now. Dr. Ikpeha, just give us an indication of, from your assessment of the problem of NCDs, I mean, is it also becoming an increasingly bigger problem in Nigeria right now?
Oh yes, it's becoming an important problem in Nigeria, as there's an increase in change of lifestyle, people, there's increased urbanization, and people begin to have lifestyles that are not what they used to do before. For instance, people smoke more, people use alcohol in harmful doses, people ingest more processed and and refined foods, and this also puts them in higher risk of developing non-communicable diseases. You know, Nigeria is a middle-income country, and we are yet to tackle the problems associated with infectious diseases, and now we have a burden of non-communicable disease, which further puts stress on the health system here in Nigeria.
So what is government's policy towards it? What has been the health ministry's response to dealing with, I suppose, a health sector that is going to be under increasing pressure?
All right, the Nigerian government actually has been putting in place some screening activities. For instance, in Lagos State, they do like screening for hypertension, diabetes every quarter. That's about 4 times in a year. This helps in catching those who are yet to know that they are diabetic or hypertensive. Also, the Nigerian government has a bill on tobacco use, which restricts the use of tobacco. We're supposed to restrict the use of tobacco in the open or in enclosed areas, so as not to put those who are not smokers at risk of developing respiratory diseases, which are also part of the non-communicable disease we are talking about. Also, there are more activities geared to screening of people against cancers, cervical cancers, breast cancer, prostate cancers. There are more awareness programs on air in communities, and as well as in offices, schools, and all of that.
When it comes to South Africa, I suppose, and then we can also, bring, is it the same story here when it comes to the response to tackling NCDs?
Yes, I think the South African response has been very strong, and they've focused very much on prevention. And so we know, as we heard from our colleagues in Lagos, that there are 4 major risk factors that contribute to non-communicable disease burden. This is tobacco consumption, harmful use of alcohol, diet, in particular salt consumption, as well as physical inactivity. And essentially, we have public policies that we know work, particularly for tobacco and alcohol, which are major drivers of hypertension, strokes, and this is really an important emphasis, prevention and public policy, to be able to prevent an even larger burden of non-communicable diseases.
Aaron Motsoaledi, who is the South African Health Minister, put forward in his budget the focus on NCDs, highlighted the cost to the economy. Do you think that the kind of focus that we're getting from someone as high level as Mr. Motsoaledi is feeding into policy action?
Yeah, I think Dr. Motsoaledi is really doing a great job in terms of health promotion and as well as preventative measures. As you are aware, his deputy, actually Dr. Ramokgopa, was in Tsanen last week, where she invited the former Olympians, former football legends to participate in encouraging people to start walking, doing long walks, so that they can actually reduce their body weight. Because even in ourselves, when we, as a scheme, Bonitas, when we do our wellness days, we realize that quite a number of people, they're overweight. And overweight, as we know, it leads to obesity, and ultimately people end up with diabetes, which is something that can be prevented. And also you find that even in some confirmed diabetes patient, if you can start with exercises, that is an intervention that can actually reduce the amount of tablets or medication that they get.
We all know what we should be doing. I mean, this applies to everyone. It applies to all of us sitting around here, be healthy, eat better, reduce salt consumption, exercise. Stress is a major factor, though, that feeds into this. I mean, do you think that the kind of current approach, JJ, when it comes to, talking about being healthy, promoting it, do you think that we need something else, a bit of another kicker, incentivization schemes?
Well, the interesting thing is, as you said, we all know about it. We all know that we should be actually living healthy. But the issue that what we see developing is that there is a development in terms of diabetes. There is still the things of mortality in mother and children. Those things still require various programs where we can use technology to actually support us in terms of that. In the case of mother and child, if you do screening of women in the pregnancy period with ultrasound, you can actually have an impact in terms of mortality. Obviously, we've also had experience in terms of a country like Egypt, where we've been quite involved in mammography screening. And and we've screened more than 106,000 women in terms of mammography screening. And what we do see is that you can have a material impact, and you can actually pick up these situations when they've moved from where we should be doing it, the lifestyle changes, to when we start seeing the actual prevalence of these diseases developing.
So it's also about awareness, which you're raising here, and certainly what the minister is trying to get through here in South Africa. You know, when it comes to Nigeria, give us a perspective, Doctor, on what the awareness is from the local population around NCDs and chronic diseases like cancer, high blood pressure. I mean, do people understand? Do people have a good grasp as to these certain diseases?
All right, yeah, people are beginning to have more awareness on the issues of non-communicable diseases, especially cancers. There's more awareness now on breast cancers. People are being taught how to examine their breasts on their own. School girls, ladies in the workplace, in the hospital, when people go for antenatal care, they are taught on how to do self-breast examination. And are encouraged to also do clinical breast examination at least once a year. There are also awareness put on air on cervical cancer, why women should have a pap smear done at least once in 3 years. For those who are sexually active, and then those above 50 years, you have it done at least once every year. There's also awareness for men as regards to prostate cancer, also on testicular self-examination, why men should have this done so as to catch any cancers early if they occur. So I think the awareness is beginning to increase even from all levels. However, for those who are not in a corporate environment or in a working environment, also health education is being taken to marketplaces, but the acceptance there is still, low, because the cost of doing some of the screening services available, like the pap smear, is on the high side. So that's still where we have a little problem. But the self-breast examination, testicular self-examination have been well accepted by the people, and people are beginning to do more as regards that.
Bringing up issues around cost, bringing up issues around greater awareness. When it comes to cost, I mean, how much more costly is medical aid right now as a result of NCDs? Are there any studies into that?
Yes, there are studies that we have done within our scheme, Bonitas, on the basis that, the minister's report on the NHI says the NCDs, they cost close to about 28% of the country. And as a scheme, we found that, if we can be able to prevent that 28% cost on the chronic medications or chronic conditions, as we call them, the lifestyle diseases, that will actually be converted into reducing the premium of a member, which is close to about 30%, which in a long run... So
premiums for medical aid at Bonitas could come down by 30%?
Correct.
If you could, eradicate NCDs altogether?
Absolutely. Because also one of the biggest costs in terms of healthcare is the hospitalization of those conditions. As you know, hospitalization is quite an expensive admission or an expensive intervention as a mode of treating those conditions. Therefore, if we can be able to deal with those NCDs, I think there's a long way in whereby we can be able to cap the cost of healthcare going forward.
So even before someone gets into a hospital, you need to look at this, and that's why you brought up the issue of prevention.
Yes, really. I think so, definitely, because if you take a country like South Africa, where we are invested in home healthcare workers. These workers, there's I think 120,000 that the government's invested. We see similar things in Kenya and other countries as well, where they've invested significantly in the home healthcare worker situation to keep the patient at home or the person at home or near a rural clinic. And I firmly believe that if we focus at that level, develop the tools, encourage those people who are the home healthcare workers to do more things like investigations when they're discussing with people, whether it's blood pressure, whether it's lifestyle, understanding lifestyle changes, explaining those things, we can maybe a major impact in terms of more rural communities that are impacted by this move from rural to urban to middle class development. And there can be opportunities to really impact there as well.
Yeah. And we get a lot of reports on this in the media, but as someone who is very closely linked to monitoring the healthcare system in South Africa, how under strain is it right now?
The healthcare system in South Africa.
When it comes to hospitals, when it comes to places that we'd traditionally go if we got sick.
Well, I think that this is absolutely correct. We have to move from the curative care, hospital-based approach to the primary healthcare approach. And this is definitely the move that's undergoing in South Africa, where we're investing in primary healthcare. We're making sure that we have health workers available at the primary care level. We have the medicines, we have the technologies. This is a long process.
Yeah, give us an example of that.
Well, I think in South Africa, of course, we have the national health insurance pilots. This is the best example, where you have 11 districts that are where there's a strong focus on strengthening primary health care, essentially what we're calling the re-engineering of primary health care, to make sure that these facilities can provide a comprehensive package of health care.
What is going to be the biggest challenge when it comes to making sure that these are a success?
Well, I think that it's establishing the primary healthcare system and making sure that we have qualified health workers available and that we have a good referral and backup system. I think that a successful chronic care model requires the primary healthcare center at the focus, but of course you have to have a network. You have to have backup, you have to have support systems, you have to have referral systems, and so establishing the network to deal with chronic conditions is the challenge.
Doctor, if you could just give us a perspective from Nigeria once again, because we just want to look at the issue around here, the healthcare sector. There's also reports in terms of the inability of, as you were saying earlier, the Nigerian healthcare sector to meet with current needs. So is the model of looking at the primary healthcare sector and focusing energy and attention on providing resources at that level something that is going to be prioritized in Nigeria?
Yes, there have been efforts to actually strengthen the health systems in Nigeria, especially the primary healthcare systems. There are efforts to provide healthcare systems, primary healthcare centers in all local governments, and to make sure that they are well manned, they are well equipped, so as to provide a comprehensive healthcare service for everybody in Nigeria. However, there's still the limitation of having healthcare personnel in some rural areas, because there's like a massive clog of healthcare personnel in the urban areas, and people are not really willing to go to these rural areas. However, there are some schemes in place now that are providing incentives for those who are going to be able to go to the rural areas. For instance, there's the midwife service scheme, which is supposed to provide healthcare for those in the rural areas. So these are efforts that are put in place to make sure non-communicable diseases are well tackled, both in the urban and in the rural areas.
Well, I mean, what about training the people who are already in the rural areas, and you don't then have to incentivize them to go there to be kind of trained in providing this healthcare, or what do you see as a solution to the issue of not having enough personnel rather in these areas?
Yeah, in some rural areas in Nigeria, there are a few health personnel. These health personnel are trained and retrained. However, there's a need to also put in place more trained staff, for instance, doctors or midwives or trained nurses to supervise the voluntary or village health workers that are in these rural areas. So that's why there's a limitation as regards that. There are people in these rural areas that have been taken out, trained, and sent back, but they need supervision to ensure an adequate medical care for those in those rural areas. So that's why there's a need for training people from outside and then sending them to those rural areas.
What's your experience?
As well as
yeah, sorry, carry on, please.
There's also Okay. All right, okay. I was going to say that as regards technology, use of technology, some of those people in the rural areas are not able to use technology appropriately. So there's a need to post people from the urban areas to these areas so that the medical care of those in those areas can be wholly taken care of.
We have to go on to the technology story now because it keeps coming up, and it's not obviously a new concept, using technology to diagnose and to help people who need attention from doctors. So Philips, right now, tell us about some of the technologies that you're developing in this space.
So, well, some of the technologies really is around where we see is the opportunity to develop technology even still at this stage that actually allows us linkage from the rural area through to the clinic, through to the district hospital, because it's about the shifting of information, appropriate information that is collected through. So we see work occurring in that direction. And part of what the studies we mentioned earlier about mother and child mortality and the use of ultrasound is part of that, because it's about using a nurse to do simple scans. The information is transferred elsewhere for more primary diagnosis, and then the results are given back. And you can have significant impacts in terms of mortality by actually using technology appropriately by a lesser skilled technician being diagnosed by a more advanced specialist in a center, and then actually using mobile technology to transfer this information through the network. It can be a big impact.
Is technology being brought into the center of the solutions that the WHO is looking at right now? And I suppose it's not just about NCDs, it's about managing any diseases.
Absolutely. I think that technology is critical to reforming the healthcare system to be able to ensure that 80% of patients can be treated at the primary care level. This is happening in Europe. It's happening in the U.S., where we are moving patients out of the hospital. They're being treated on outpatient basis in primary care clinics, and patients are happier with this care. It's closer to home, and they're getting good care, and they're getting a strong referral and backup.
Bobby, tell us about technology and how it also relates to the world of medical aid.
No, I think that's a very interesting point coming to the question of technology, because as you understand, with prevention of primary health care, education is the most important way of informing your members, or informing your colleagues, or even informing the ordinary man on the street. Electronic media. I mean, at Bonitas, we've got a TV program that is watched every Saturday. It covers close to more than 3 million people. And it's a popular program whereby we make sure that we advise our members on the primary healthcare related issues. And therefore, if we can utilize that, inform people what needs to be done. For example, using the electronic media of the SMSs or texts using cellular phone industry. We normally use that to inform our members when is the right time to go to the hospital, when is the right time to go to your clinic, to have your checkups on your maternal care. We also use that also to remind them to take their chronic medications. So in that way, I strongly believe that the use of technology, it will go a long way in cutting down this scourge of NCDs going forward.
Olan, if we could just get your perspective on the cost of technology right now and the relevance of it in an environment where, of course, there are various income groups in Nigeria, but if you're looking at the rural income groups, it could be a challenge when it comes to the actual cost of this technology, or is there a way to get around that?
In Nigeria here, because we have a lot of low-income people who live under the poverty line, so using technology to get to them may be a little restricted. However, there's an increase in adoption of technology. We use SMSs to get to our patients for their clinics, like the other speaker has said. We also use technology in diagnosis. However, the cost is still a problem, especially for those in the rural areas. There are opportunities for those in the urban areas to access information on the internet, or from electronic books, or from other devices, from their mobile phones. There are opportunities for people to get to know about non-communicable diseases on their phone by just simply subscribing to their service providers. However, those in the rural areas are most likely not educated, have limited access to all of this. So it still poses a restriction in the effective management of communicable diseases.
So ultimately, you know, just bringing up the issue.
Non-communicable diseases, sorry.
Yeah, I mean, just ultimately bringing up the issue of internet and internet access, broadband access, and applicable here to South Africa as well, Sarah. Yeah.
The access to technology.
Yeah, well, access to technology and the issue around internet access in rural areas. I mean, that is going to be a major factor, which is going to hold back adoption unless, you know, unless it's faster and we have that implemented across the communities.
Well, I think what we need to do in South Africa as well as other countries is put together a concrete plan on comprehensive prevention and control of NCDs. And it's really an approach where we start with prevention, we start with public policies. These are policies that can be implemented everywhere. And you look at what you can do within the primary care system, what kind of technologies can we scale up. Certainly in some communities, you know, in many countries, in urban areas, you have this technology available, and so it should be utilized. We should test it, we should try it. But we really do need, and this has been done in South Africa, a plan where you look at what is viable and what kind of technologies are applicable within a given setting.
That's why I suppose the proliferation of mobile phones has, you know, applicable certainly in Africa when it comes to providing the information that we need.
What do they say? There's more mobile phones in Africa now than there are in the United States and Europe combined. And the adoption of technology, even in terms of retail shopping in Africa, is really escalating tremendously. So we should leverage and build on the technology that is present in terms of mobile phones and applications that can run on that to actually support these type of programs we're talking about.
Yeah. Well, let's take a quick break and of course continuing this discussion after the break and specifically focusing in on solutions to combating the rise of NCDs and of course incentivization for people to become healthier and preventative cures for NCDs. So more Philips African Dialogues after this short break. Do stay tuned.